started.
Hi, everyone. This is Foley Vision Center. We've got our aesthetic team with our beautiful Gabby here is getting treatment with lovely Amy. And of course, all know Stevie, who is going to be doing the fun stuff at the end, our prizes and all the good stuff. Today, we are going to be talking about tear care and radiofrequency and how we combine these two treatments together to maximize tear film, thickness, comfort, help with ocular surface disease, get rid of a few wrinkles while we're at it. Yeah, ladies, that's always nice to have that little extra yummy thing that we get from these treatments. And we'll talk about these reasons why we're doing it while you get to actually see it in person. Gabby is acting as our wonderful patient here today, and she's all snug as a bug in this lovely, wonderful cocoon that she's in with this nice weighted blanket on her, and she's cozy. She's been spending about 12 minutes or so with the thermal. You're going to see on the eye upper and lower lids of both eyes. This is our tear care procedure. It heats up as high as 45 degrees Celsius, which is a wonderful way to get the glands inside the lids heated up to help them start expressing properly. Generally, after this, we'll then go into and do a radiofrequency treatment to get even better expression in heating. This combination together can be really amazing, and sometimes we'll do this with IPL at the very end as well. So it's really a terrific way to go. How are you feeling right now, Gabby?
I am in Zen mode. I can barely talk. I'm just all cozy. It's gonna be hard to go to work later.
Yes, it is quite lovely, and you feel like you're just kind of in a wonderful, warm embrace, eyes as well as body. And it is a lovely way to just kind of relax, especially after a really long, busy day. It's quite amazing. So, what we're going to do is we're going to talk about, I'm going to share screens here for a little bit before Amy starts working on Gabby and doing the radiofrequency treatment. So, we're going to just share a few things. Okay, it's kind of like, why do we do all this crazy stuff, right? Let me see if I can pull this down a little bit. Okay. So the meibomian glands, which are what we're really going after, live deep in the lid structure, and we can't see them without the aid of this infrared technology that we have. Here in the practice, when we're treating ocular surface disease, to get that tear film nice and thick and lustrous to help you see better and feel better and look better, it really helps us to know where you are on the spectrum of gland loss. We know that many things can cause gland loss, from not blinking enough, and we're on all these wonderful screens all day, to age. That has a part of it, unfortunately, especially as ladies over 50 and menopause and hormone regression. And so that can slowly, as you look at stage one, is what we would love to see everyone look like: gorgeous, long, white glands deep in the upper and lower lid. And as you see stage two, we're starting to see some of this gland loss. Mostly it starts nasal and then eventually temporal, to the where you see the third stage, where you have just little stubbies left on the bottom lid. And the lower lids are really the main producers. The top lids are helpful. The bottom lids are where it really happens. So we saw a beautiful woman today who had a major sty, was referred into the practice. Styes all occur from those glands getting infected, and styes happen from, as we all know, those lovely mites that we talk about. We'll probably spend one of our times talking about the mites and showing more and giving you guys more information about them. But as it is, we know everyone's got them, and that's why we're big on lid hygiene. All right, we know that we lose 1 to 2% of collagen and elastin in our whole face after the age of 30. Sun damage, smoking, poor diet, all those things make our face age faster. Why does that matter to the eyes? Well, the skin of your eyelids, it actually ages even faster than the skin of your face. And that causes the upper and lower lids to get very loosey-goosey, which messes with your blink, messes with the glands expressing properly, messes with the ocular surface. So why we love radiofrequency is it helps improve that gland structure. As we go, when we're doing the temperature treatment that Amy's about ready to do, you'll see that this is kind of a typing of your skin, and it's cross section. And that divot that you see is a wrinkle. Well, those start happening due to this collagen loss from the top. But look at the very bottom where you see these little guys that look like flying saucers at the bottom. Those are your fibroblasts. They produce your collagen and elastin. And when we're younger, they sit up really high in the skin. As we age, they start to drop, kind of with gravity, like everything else. And radiofrequency does a great job of exciting those fibroblasts, helping them bring and restore that collagen back to the surface, which in turn tightens the skin, which then in turn gives us better structured function of the upper and lower lids. And happy to say, reduces fine lines and wrinkles around the eye. This shows you a little bit up close of a patient who's getting a temperature treatment, but we're going to get to see wonderful, wonderful Gabby having her temperature treatment right here on the spot today. What's really great about this treatment is that it gets deep heat in, and you're going to hear those lovely little tones that you heard just a second ago, because this instrument, unfortunately, it has these wonderful tones that can almost put somebody to sleep, but they are very comforting and they help really well. You saw that she had these wonderful little pads around her eyes, and those were the Tearcare adhesions that go on. They heat up using electrothermal system, and it's about 12 minutes. Again, very comforting. You could be reading while you have this done, or we love to just have you just sit, relax, or lay down and just have a little nap. Works really, really well here. So now what we're going to do is we're going to stop the share, and I'm going to spotlight these lovely ladies so you guys can see what's going on. All right. So here we go. And they have, they must have muted themselves because we're not hearing that beautiful sound, but that's okay.
Can you hear us?
I can hear you now. Very good. So she's working on Gabby's left eye right now. And as you can see, it looks like a little kind of reminds me of when you're using one of those pens that has, the help me out here. I'm having one of those moments where, you can just kind of mark up something, but it has gentle heat deep into the lid structure. She's using the orbital bone. This is Amy that's doing the procedure. And the reason we're on the orbital bone is bone conducts so much better than any other part of the face. And bone conducts those radiofrequency waves that are attracting down deep in the dermal tissue, exciting the water molecules up to about 42 degrees Celsius, and getting those fibroblasts to start coming right back up to the surface. Of course, Gabby has been really proactive with her skincare, and we are really big on prepping before any treatments with good skincare. And that's why Gabby's really meticulous about before any of our patients start doing any treatments that we have them on good clinical skincare so that we get the pH right. And so when we're doing the treatments, we get the best results possible. I think Gabby's going to fall asleep by the time we get to the second eye here. But basically, it feels like a hot stone massage, and it's very relaxing. The Eye Envy handpiece that's brand new just heats up so quickly. We don't have to do a lot of extra prep like we used to. And it does such a beautiful focal area that we know we're getting good targeted heat. Once we have 3 minutes of periorbital going all the way around on both upper and lower lid, then we start working on the individual lids separately for 1 minute, upper and 1 minute lower. And that's when you're going to see Amy bringing out some gauze to adjust and move the lids up onto the orbital bone, because again, the orbital bone does such a fantastic job stimulating that heat and getting it deep into the structure that we need it to do. This particular treatment originally came about many years ago, used in some surgical applications, and then radiofrequency got a little bit more refined in the last 5 to 10 years. This particular device has been around for about 6 years. It's really the Cadillac of radiofrequency devices and does a phenomenal job. So it looks like we're ready to start on the lids. Sometimes we'll adjust the settings just a tiny bit, depending on the person's age. And she's going to be using the gauze to pull that lid up. We're just needing a little bit of the lid up onto the orbital rim. in order to get good deep heat that goes all the way through the glands and helps with expression. Since she had the Tearcare first before doing the radiofrequency treatment, we will see, and Amy will be able to see this even better than us, just those glands just expressing like mad. And after a treatment, it's not uncommon for people to go, wow, my eyes just feel so fantastic. They just feel so lubricated because those are your own oil glands working again.
Okay.
It's also good. Yeah. How are you feeling, Gabby?
I'm gonna pass out. I think I might have to call out sick for the rest of the day.
It is very hard to have one of these treatments and go right back to work. You really just want to go home and take a nap. It feels that marvelous. So when you feel like you need to treat yourself, and we've got Mother's Day coming up, by the way. We've got some things that Stevie's going to talk about at the end here on our wonderful Mother's Day, so to speak, little bonuses that we have going on. So now she's done 1 minute on the upper lid. And now we're going to do 1 minute on the lower lid. The nice thing about radio frequency is there's no downtime. And you can have a treatment and immediately go right back to work. You can put makeup on. You can have a treatment all year long. We don't have to worry if you even have a little bit of a suntan. It's going after water molecules in the skin, so we don't have to worry about your skin type. All 6 types of skin can be done. Every melanin level, doesn't matter. It's totally safe. The only folks that can't do this are people who have a pacemaker or something implanted in them where it's sending off a Bluetooth device. That and a gold or a corn allergy is problematic because the ultrasonic gel we use can have a corn allergy to it. So if we have a corn allergy, we don't do it. The gold tip to the radiofrequency device, which helps conduct the radiofrequency waves, is made of gold. So therefore, if you have a gold allergy, it's a non-starter. But there's so few people, we usually are able to do almost every single patient that comes through. So the lower lid now is getting activated. Again, same thing, just looking really, really good. And she is ready to rock and roll. As you can tell, it really doesn't change how her eye looks, although we get a little more of a lid lift in the upper lid. Of course, she's so young, her lids look great anyway. But if you saw me and we did a one eye done, one eye not, you definitely would see the difference in my eyebrow. The whole face that had it done would look more lifted. And again, it's more of that natural lift. It's not something that looks like you've had Botox done, but it just gives you a natural lift, which is very lovely. All right.
I will say, when I get a full face, I catch myself in the mirror and I have to take a step back and be like, ooh, something's different. I don't know what, but there's something. Good. Yeah, there's something.
Yeah, a full face radiofrequency is to die for, and it does do a glow up. We have a lot of people do it right before a wedding, and it just makes you just look so radiant and beautiful. Again, it's going after those water molecules deep in the dermal tissue, and you'll see lasting effects upwards of 6 months where it just keeps building collagen and elastin. So this is something where you get a beautiful glow up, but then you get continual benefit, which is really fantastic. Most folks for dry eye, depending on how severe their ocular surface dry eye is, we'll be prescribing anywhere from 2 to 4 of these treatments. Or if we're only doing radiofrequency only, it's usually 1 treatment per decade of life the patient's in. So if there's 60, we usually will prescribe 6 of them. We go about every 3 weeks because that maximizes that collagen build. And that really helps with structure function of the upper and lower lids. So that's critical. When we're looking just for an aesthetic viewpoint, sometimes we only need 3 to 5 on the radiofrequency. You can do it on your neck, your décolleté. Amazing the different places that you can lift and separate in a nice way and giving a nice lift. It really does a beautiful job without anything that is systemically changing. There's no side effects to this. It's very, very safe and very, very relaxing.
I will mention, to get the most out of your radio frequency treatment, you want to be really nice and hydrated. And when I say hydrated, I mean water, not like Gatorade or
Yeah.
coffee. Or coffee. You want to be nice and hydrated the day before and the morning of.
Good point. Very good point, Gabby. Yes. Since we are going after water in the skin, if you're dehydrated, you'll be sitting there for a while and we'll know because we can't get you up to temperature and we'll reschedule you. So we do talk to everybody about this, but you know, life is hectic and busy and we forget sometimes. But yes, and it's good to stay hydrated all the time, right, ladies? I mean, this is really good for our skin. And you know, I drink a lot of tea and water, usually warm water to keep my throat going. But yeah, that means I have to run to the bathroom a lot during the day. It's my second office here in the office, I think, but it's really good for us. All right. I think while we get to watch you ladies, I'm going to switch over to Miss Stevie here now. Okay. And we're going to highlight Stevie to go over our our wonderful prizes. And I'm going to mute myself and let Stevie take over.
Okay. Well, today we're going to give 20% off, if I can talk, all radio frequency packages, 20% off the core 4. And we're going to pull a prize. Somebody's going to get a box of the Be My Lady steam heat masks. So we'll find out who that is today. Wait, I have one more. I have one more question. No, I'll ask you later. Okay. So the winner of the steam mask is Rebecca. Rebecca.
Yay.
Woo. So that's it. So just go ahead and give me a call and we'll get you signed up.
All right. Back to lovely Gabby here. And we're pretty much done, right? Yeah. She's getting the upper lid and the lower lid done now. She's almost completely done. Looks like we have one question. Would I get faster medical or aesthetic results if I treat more frequently than one time a week?
So do you want me to touch on
Yeah,
that one?
you
So
go
when
for
we
it.
look at when we do certain treatments, like how far apart, we look at how our skin turns over. So it does take a little bit because technically this is almost promoting a like healing response because it does target that water in the cells, which gets the cells up and moving, which then activate those fibroblasts. So not necessarily, I know radio frequency can be done as close as 2 weeks apart. But we like the 3 weeks apart because then you get the most out of it as far as you're still getting that aesthetic benefit, but we prefer for OSD to do 3 weeks apart. And we want to give the skin at least 2 weeks to kind of have that skin turnover.
Awesome. Great response there, Gabby. We've gone to a lot of meetings and she's heard me lecture a ton. I think everybody's heard me almost to ad nauseum. And I just gave a lecture just this week. So we were talking to eye doctors to try to get everybody up to speed. And I definitely think we'll probably do one of these down the road where we show a BluffX treatment where we do the debridement of the eyelashes and the mites so that we can really go into some of the new fantastic things that are available to help us rid those pesky little critters. But this does a beautiful job of just heating and expressing, which just feels so marvelous. And as you guys can see, it really doesn't take much time at all. Usually total from the moment you are prepping to the moment you're done is about 15 to 20 minutes tops. So it's an easy thing to pop into the office for a short, quick session. A full face takes around 45 minutes. We always tell them when to give ourselves a good hour for that. And then again, I would say if I were to have a full face, I'd be just going home and just taking a nap afterwards. All right. So I think that does it for us. I'm gonna kind of let us all kind of let folks get back to your wonderful day. Thanks for spending your Tuesday with us. And next month, we've got, I think Gabby is talking about for next month, our webinar for next month, Gabby.
Summer skincare. So things that are encouraged and safe to use while you are responsibly getting sun exposure with sunscreen and shade and hats.
Yes, we know we like that. And our sunglasses, our
And
gorgeous
sunglasses.
sunglasses. So, yes, we want to make sure everybody is good and safe. It's, we get sun exposure all year long. So that sunscreen is so important. And we have the only one out there right now that is safe to use around the eyes. So thank you everyone for coming. Thanks, Terry, for your wonderful questions as always. It's been great to spend this little time with all of you. Look forward to seeing you all next month. All right. Bye from Foley Vision Center.